we got a study for this Zidovudine drug, which I know it come in a capsule, tablet, and syrup, and it's a NRTI, which is a nucleoside reverse transcriptase inhibitor. But I know Ms. Morgan want me going into that. So what does that mean?
All right, so right here it say NRTI that inhibits replication of HIV by blocking DNA synthesis.
So it is used to decrease the amount of HIV in the blood. So because it's used to treat HIV infection, can you give it to pregnant women, infants, and children?
Yeah, it's one of the main treatments that you can give to pregnant women. It stops the perinatal transmission to the neonate.
Well, I know it's given in a capsule, tablet, and syrup, but I don't know the doses of how you should give it to each one.
So pregnant women take it at 14 weeks gestation. It's a 100 milligram capsule, PO 5 times a day. And then once they go into labor, they gonna run it IV over an hour. And then it's gonna run a continuous infusion until the baby is born. And when the baby is born, they take a PO dose every 6 hours, up to 12 hours after birth, and continue until 6 weeks old.
Side effects of this medication is stomach pains or cramps, hot burns, diarrhea, especially in children, constipation, headaches, difficulty falling asleep or staying asleep. The patient should call the doctor if they experience having a rash, blistering or peeling of the skin, hives, itching, difficulty breathing and swallowing, swelling of the eyes, face, tongue, lips, or throat.
So Zidovudine is contraindicated in breastfeeding because HIV appears in human milk. You don't want to take it with severe bone marrow depression, liver dysfunction, anemia, and patients with white count and low hemoglobin. You want to use it cautiously because it can decrease both of them.
So a patient needs to know if they skip a dose to still take the medication as scheduled. Do not double dose. Keep a normal diet and take as prescribed, no more or no less.
Okay, so you also want to teach the patient that they take the meds without regards to meals, so they can take it either before, after, or with meals. Blood transfusions may be needed during therapy because the drug induces anemia. You want to tell the patient about the report loss of subacute fat in the face and limbs and buttocks. And you also want to teach signs and symptoms of lactic acidosis, nausea, vomiting, shortness of breath, and weakness.
Some frequent labs to monitor is ALT, AST, ALP, and LDH levels may increase. So the patient needs to report if they have dark yellow or brown urine, light colored stools, yellow of the skin or eyes, and RBCs, WBCs, granulite, neutrophils, and platelet counts and HB levels may decrease. So the patient needs to report if they have unusual bleeding, bruises, fevers, chills, and pale.
Girl, that medicine got a lot going on with it.